All right, so now let's look at what things we want to ask in the interview. And some of these things we've touched on in that triage. Remember, triage is immediate threats. Then we've gotten some information from the prenatal. So when we go in to do the patient interview, what other information do we want? We want to know, do they have any allergies? Again, always confirm that. We want to confirm the data from the prenatal record. If we see the prenatal says they're group B strep positive, confirm that with the patient. Have you been told that you are group B strep positive? Have you been told what that means? And this is what we'll do. We want a general medical and surgical history. I want to know if this patient has cardiac problems or liver problems. So what a general medical history, general history of what surgeries they've had. We want to ask them about their obstetric history. Even though some of that's in the prenatal, we want to get that from the patient perspective. And sometimes we get information that they haven't shared with their provider. We want to ask about the health of the current pregnancy. Have you had any difficulties with this pregnancy? What brings you to the hospital today? If they have contractions, we want to know how long, are they regular? How long have they been having contractions? Are they regular? How far apart are they? How long do they last? How strong are they? What do they feel like? Do they feel like tightening? Do they feel like pain? Do you feel them up high, down low? Does anything change them? We want to know if they're having any vaginal discharge or bleeding. What does it look like? Is it mucus? Is it bloody? Is it watery? Is it, does it have a different color? Is it green? Green in particular, we want to know about. Do they think their water's broken? We could ask, has your water broken? Or do you know if your water's broken? And if so, what makes them think, like, did they have a big gush? Did they just notice that they felt damp? Did they have to put on a pad and they just kept leaking? What is leading them to think that their water's broken? It's really easy to confuse this with urine leakage or with increased mucus. So if their water's broken or they think their water's broken, when did that happen? How long ago was it? What color was it? Since the water broke, has the baby moved? Okay. We want to know what their recent intake is in case of emergency surgery. When's the last time you ate or drank anything? Now, facilities have different policies about continued eating or drinking, but when they first come in, we want to know when's the last time you ate or drank anything. Have they done anything to prepare for birth? Have they taken any classes? What do they know? What have they done to prepare for birth? How do they plan to feed the infant? Are they going to breastfeed, bottle feed, both? What are those plans? Do they have a provider for the infant? If they don't, then we've got to figure out who's going to assess, what provider is going to assess and provide care for the infant while they're in the hospital. If they're expecting a boy, are they planning to have that boy circumcised? Photography and video is included in here because some facilities offer those as a service. Sometimes there's a cost, sometimes there's free. Sometimes also families want to know, can they photograph or video? So we want to let them know what the hospital policies are and what their plans or expectations are. And if those services are offered at the hospital, we want to let them know about that. We want to ask if they have any specific requests for labor. We want to be aware of cultural differences in response to labor and to pain in general. Remember, though, not to generalize too much. Remember that even though there are cultural patterns, individual people are still individual people. The same thing with who is present. So we want to ask, who do you plan to have with you at the time of birth? What will they be doing for you? Is that your support person, or is that person there just to be present for the birth? We kind of have an idea in the dominant Western US culture. We kind of have an idea of the father of the baby as a birth coach and a really active participant and being the primary support person. But in some cultures, the primary support person for a laboring mother should be another woman. And so if the father is there, They're there for their own experience of the birth and not as a support person for the laboring patient. So, find out who's going to be there, or who do you plan to be there, and what is their role. If they are not an English speaker, or if they have English as a second language, find a translator. Even if someone speaks English, when they get into hard labor, they're going to have a hard time translating mentally. So if English is not if they're not really fluent, if they're still having to mentally translate, English gets harder as they get closer to birth. So having someone who can speak to them in the language they're most comfortable in is really helpful. During the interview, we want to observe how that client interacts with the nurses, but also with their partner and other family members. And sometimes we may notice some issues, some tensions that we might need to follow up on or observe more closely. Assess for stress and fear. If they seem to be very fearful, or if they talk about being afraid, we can offer some support and reassurance. We want to screen for domestic violence, and you don't do that by asking, is there any domestic violence in the home, while everyone is standing at the bedside. That's just to check off a box. We want to ask them when they're alone, are you safe at home? We don't ask usually if someone has a history of sexual abuse, but if a client volunteers that, it's because they're expecting that history may have some impact on how they respond to labor, and we need to be aware of it. We need to treat every patient with respect for their body boundaries, and assume that we could potentially be triggering some PTSD in patients, even when we're not aware that they have it. Okay, so we want to treat everyone with respect. The biggest thing, the best way to avoid that is to always tell the patient what you're doing as you're doing it, or before you do it. Ask permission. Even in an emergency situation, have someone explaining things to that patient. I've actually run down the hall explaining to a patient while we're going to emergency C-section as we go, because it's terrifying, and we want to make sure that we're remembering it's a person in the bed and not just a body. Okay, the next section is going to be about the physical exams in labor.